Hey, it's Tess, content creator, model, presenter, and host of the Tess Talks podcast, on a mission to ignite curiosity. Welcome back to Tess Talks, Nat.
Oh my goodness, thank you so much for having me. It's been a time, it's been a while.
It has been a long time. For those of you who don't know what I'm talking about, Nat joined me on a few of my live events years ago when I was doing Tess Talks Live. You joined quite a few.
I know, I really jumped on that bandwagon, didn't I?
Yeah, you did.
They were too good not to. And it was just, podcasting's fun, live events are fun. It's nice to bring a bit of a mix of both, really.
Yeah, and I just absolutely loved having you on because every time I would get such amazing feedback having you on. You're such, I think, a pioneer in your field and in Australia when it comes to women's health and hormones. So I think I should probably elaborate a little bit about some of your background so those who are listening who don't know about what you do can have a bit of an understanding. So you've got a degree in health sciences and Chinese herbal medicine and acupuncture, which I love that you hybrid these worlds. You're also the founder of Melbourne's leading women's natural health clinic, the Pagoda Tree, which I've been lucky enough to go to a few times. And you're the author of 4 books dedicated to women's health and also a passionate public speaker. And you have your own podcast. And I actually have one of your books here today with me, which I can't wait to delve into. So I don't know if I've missed anything.
No, I think you covered everything. I kind of start to cringe a bit. It's like, but it has been a long time. All of those things have been an evolution.
Yeah.
And just one thing's happened after the next, which has been so nice.
Well, you've got so many credentials under your belt. And I think like what I love so much about you and your work is that you always reference the scientific, but you really bring in the holistic approach as well. I feel like you're the perfect hybrid between the two. And I think that that's so important and vital in this day and age. And I think finally recognize that we need like multiple modalities when dealing with our body and our health.
Yeah, 100%. I mean, there's no one way to do anything, first and foremost.
Yeah.
It's your way. I think we've got to come back to what is my body telling me? How can I learn and listen to read the signs? And then what's the next best decision for me right now? And I feel like a lot of women make decisions out of fear or lack of knowledge. So if we can become more empowered, if we can ask more questions, get clarity and very clear on what our body is telling us, then we can make better decisions for ourselves. And I think we've signed over the power of that to a health professional. And I'm a health professional and I tell people my best opinion, but at the end of the day, we've really got to sit with what we're being told and decide, okay, does this feel like the next best step for me based on my understanding and my research? Of course, we need to turn to professionals, but at the end of the day, we're living in our own skin. So how can we be more empowered to make what we feel like is the best next decision? And your body will follow. That's the other thing. It knows what to do. We've sometimes just got to get out of the way. We like to force things. We like to make things happen. So I really love helping women understand their hormones simply so that they can make a good decision, not just for now, but for their long-term health.
So true. Is now I'm so passionate about that because our body is always talking to us and giving us the signs. And I think often it's just that we don't trust ourselves enough to listen.
So true. We have absolutely lost faith in our bodies and the amount of women that I see. And it's easy to look at a situation and say you've got excruciating period pain. You can think, why does my body hate me? Like, why is it doing this to me? And it's doing it for a reason. There's a reason that that's happening. And so getting to the bottom of what that is and then looking at what we can do to improve the environment actually has the biggest impact on our health. So that's actually a long game, not a short-term solution. But we really need to get the answers to then figure out what is the next best step. But your body doesn't hate you. It's trying to do the best it can in any given scenario, and it's always responding to the environment. And I think we forget that.
I love so much that you said that because I've heard you say that a bit. It's that things don't just happen to our body. There is always a reason for it, and I think we skip over that so much.
Yeah, and I get it. I mean, I was once young and naive. I wasn't to say young and dumb, but young and naive. And I burnt the candle at both ends and I didn't look after myself and I didn't feel good. And it's easy for me to say this now, however many years on. But if I can reach out to that younger woman to say, hey, let's scaffold now so that it doesn't have to be a lifetime of all of the things that many of us have put up with, that to me, I don't know how, because at the end of the day, as a young woman, you think that you have all the answers.
Yeah.
And you look at the person that is now probably my age thinking, oh, you're just old and silly and you think you know. Yeah. But I actually do think the way we do this is just to have a lot of conversations around it.
Yeah.
Speak to our daughters, speak to our loved ones, constantly have an evolving conversation so that it's not this gap of, oh, you're young and then you're old and then you're broken.
So true. It's such a common story, and it's exactly the story that I went through myself. And as much as I look back and I'm like, I wish I knew all these things earlier, in a sense, I'm glad I didn't, because it's those silver linings on how much I have learnt through going through these different health issues and journeys over my 20s to get to where I am now, and the different knowledge that I've learnt over that time.
Yeah, and then it's going to come now again because we have children and then we've got an opportunity to pass on that wisdom and have the conversations that need to be had rather than brushing them under the carpet. I don't know about you, but the conversations I had as a young woman or even a child with family members, especially your mum or your dad, they weren't necessarily honest conversations. They were conversations that skirted around the truth. So that when it came time to learning about what my body actually did, I was like, what does it do? Sorry? Like, it does not do that.
Totally. It's the same with schools. I always think like, you know, we go through this really basic like sex ed, but we don't really learn about like the body and the reproductive system and fertility, like not to the depths that we should.
No, 100%. But also to that point, a lot of what we're learning, my daughter's 16. I'm watching what she's been taught at school, and a lot of it is really outdated.
Really?
So I said to her the other day, she was telling me, I was testing her in some of her health and human development homework, and I said to her, this is not even what happens.
Oh,
and she said, what am I supposed to do? And I said, you're going to have to learn it and then unlearn it. I'll teach you what happens, but for the purpose of passing your test, go and learn that. And then I will teach you actually. So there's a big disconnect in what we're being taught and what is actually happening. And I think that the last place that it changes is in the education scenario. So that's not just education for a teenager. That's what we're being taught at a tertiary level as well. And it's slowly changing, but it seems to be the last thing that changes. So no wonder we're confused, and no wonder we're kind of looking and going, where is the real answer? How do I find that out? It's getting better. Definitely our reproductive education, our sex education is worlds better than what I had anyway. You probably had a little bit better than me. But, you know, we learned have sex, get pregnant. And then fast forward to when we're trying to fall pregnant and we learn, well, maybe it's not quite that straightforward. We have to actually match that up with ovulation. You know, we actually have to make sure we're ovulating. There's a whole lot of other things that have to happen here. And the number of women that will say to me, I'm so embarrassed I didn't know this. And I will say to them, it's not your fault. If you, A, weren't taught it, or B, maybe you've been on birth control so you haven't had to know this because you don't ovulate on birth control, then that's, again, it's not your fault, but we're always learning.
Yeah, and I think this is where it can also get really overwhelming for people because going on one of these health journeys, it almost can feel like this never-ending tunnel, and that when we do find that we're going to these certain practitioners or GPs and we're getting, say, one piece of advice or recommendation, but then we might go online or go see more of a holistic or Eastern medicine focused practitioner, we're getting completely different pieces of advice. So I think that's where it can get quite messy. There is so much information out there now that it's kind of hard for people to consolidate everything and know where to start.
I think we have to remember also whoever you're going to is going to give you the solution within their realm, within their understanding. So if you go to a surgeon's going to tell you how they're going to operate to solve the problem. If you go to a GP, your GP is going to find a medicine that's going to fix or at least help to manage your problem. If you go to a naturopath, they're going to tell you how you can supplement. If you go to someone, my background's Chinese medicine, I will find plant medicines to try and treat what your condition is. So it's who are you asking for the advice, and you're going to therefore in that scenario of those 4 that I've just outlined, get 4 different opinions based on their toolkit. So I long for the day where we have a world where everyone's integrated together, but I do my best to try and look at all of the different angles and see what is the best solution. But if someone's fallen over and broken their foot, let's say, do they actually need it to be operated on, or is there a rehab that's different to that may give the same result, that's going to be less invasive, less recovery time? So but if I go to the surgeon, they're probably going to look at, okay, well, this is how I would fix that. And if I go to the physio, let's say a rehab physio, they're going to say, well, this is how we could rehab that. Then it's the same problem with different solutions. So I think we've got to, again, that comes back to what's your way? What feels right for you? Does it feel right to have that procedure? Does it feel right to try and rehab it? It's you're in charge.
I love that. Back to empowering the person. I think that's a really good place to start, as you touched on, contraception and also just basically overall hormone function, because I feel like that really is the basis of pretty much everything. And as women going through school, one of the first things that we kind of learn about is going on contraception, or one of the first things that we're recommended to do from around the ages of 14 to 16. And I just think that that's such a bizarre place to start and a bizarre place to be educated on from the get-go. And I know you're really passionate about talking about different types of contraception and your different views on the pill and different things that are out there at the moment. But I think a good place to start would be like, why is it so important to have regulated and balanced hormones?
I mean, our hormones as a woman, if you are cycling, that is if you're not on birth control and you are following the natural cycle that your body has, and it's a regular cycle, every single day of that cycle is different. So what your hormones did yesterday and what they do tomorrow could be ends apart depending on where you are in the cycle. But as your hormones over the course of that cycle, some build, some fall away, and that actually influences how you operate on any given day. That could influence because it influences how our brain works, not just getting a period or ovulating. It influences our decision making, it influences our moods, it influences every part of us as a woman. So it's important that we learn this and understand, okay, well, where am I in my menstrual cycle? What does my menstrual cycle look like? And really start to track it. As crazy as that sounds, the only real way to actually really understand it yourself is to observe it properly. So I encourage women to track their cycles just so that they can know where they're at. I know the day before my period, I am good for nothing. My creativity is in the toilet. My team know, don't ask Nat today for anything that's creative because you're going to get nothing. Now,
team calendar around the cycle.
Now, if I don't know that, and in the past I didn't know that, especially writing a book, let's say, and I'm like, oh my gosh, I have lost my mojo. Like, where is it gone? I feel terrible. I've got a deadline. When am I going to get this back? And it feels very overwhelming and quite asphyxiating if you allow it to. But if I track my cycle and I know, oh, my period's due, give myself grace to have a day or two where I tap out, I recharge, I listen to my body and I let it do what it needs to do. It actually sets me up for the next month. I can give it grace and I don't have to worry or feel stressed by my mood or how I'm feeling overall. So we need to track it to know this. And I think the biggest gift that we can give a young woman is teaching her to understand her cycle, teaching her what ovulation is, when it's happening, that's when she's fertile, and really plotting that out to help them connect with their body and what it's actually giving us in terms of feedback. Once you do this, it's actually really, I'm at a point in my life, I'm like, how do people not know that they're ovulating? Like, it's so obvious to me but I've been tracking this for a very long time, so it should be obvious to me at this point in time. If the chances of me having an accidental pregnancy, I would have to be blind drunk somewhere, like KO'd, not aware, not even in my body for that to happen, because it's so obvious when I actually am in a fertile window. Imagine if every teenager understood that.
Yes, and I think that is so incredibly powerful because we're not educated or taught that.
We fear it.
And I completely agree, because now that I've put myself on my own journey coming off the pill and having to learn so many things, and now that my cycle is so regular, I'm exactly the same. I know to a T where I am at each month. And it is so empowering to know and have that control over your body, but then also know when to rest and when to lean into different moments throughout the month. I don't know why this isn't more common knowledge.
I think the reason is that we're living in a man's world still, as women, and that's no one's fault. That's just how it's set up. And the more we have these conversations, the more we can lean into these conversations, the less that will be the way that we exist, but we are women trying to fit into a mold that doesn't fit us. And there is more awareness. It's not so crazy now for a woman to ring up and say, I've got my period, I'm not coming in today, I don't feel great, rather than to pretend it's not there, to push on through, only to make the next cycle, you know, not as good as it could be because you've tried to push through something when your body was giving you warning signs.
Yeah.
Now, having said that, I think it's important to realise there are a lot of women who can't push through, that do have debilitating pain, that might have endometriosis or adenomyosis and are experiencing challenges. So I'm not saying that this is a one-size-fits-all by any means, but at least understanding the cycle, and also for the woman that does experience a lot of pain, being able to plan around that.
Yes.
I'd say we need to sort the pain out, but let's say we're not at a point yet where we're ready for that. Being able to plan around that phase is really important. If you don't track your cycle, you don't know when that phase is coming. Therefore, you live in fear all of the month thinking, oh gosh, is it any day now?
So what are some of the first signs that someone could start looking out for within their cycle that could correlate to either a healthy functioning hormone system or a dysfunctioning one?
Yeah, I mean, anything that's cyclic, we can generally look at, okay, what are the hormones in play at that specific time? So, for example, if I'm feeling nauseous as I approach ovulation, which can be quite a common symptom for women, we need to look at, okay, well, what's at play here? And it's more than likely there is some discrepancy in the balance between hormones. Perhaps another obvious one is PMS. So a lot of women will identify with feeling premenstrual in the lead up to their period. That tells us that there's proportionately more than likely an issue with our hormones, progesterone being the most common issue here. Progesterone's a calming hormone. We only make progesterone from ovulation through to when we get our period again. And if we don't have enough of it, we start to see symptoms of PMS. Headaches, maybe some pain, mood swings, night sweats before the period arrives. Like, these are all common symptoms when we don't have enough progesterone proportionate to our estrogen. So it's important to look at the timing of a symptom, and any symptom that's cyclic, and at the same time every month, we can generally look, okay, well, what are the dominant hormones at this time? That's more than likely where the problem lies, and how do we use the clues to sort out what that might be.
And there's clues in the colour of our menstrual blood as well. Is that
There's
right?
clues everywhere. There's clues in your, this is like really getting in the weeds, but there's clues in our absolutely, like, is there spotting before the period? What colour is your menses? Also with your cervical fluid, the changes with that, the changes in colour, texture, consistency, they're all clues. They all lead to various things, or various discrepancies. So getting this feedback actually really helps us. And the first thing we need to, like I said, do is go, okay, is this happening every cycle? Yes, it is. Okay, what time of the cycle is that happening? Noted. And then what are the symptoms that are happening, and what are the clues my body's trying to show me? But it's not as hard as we think to figure out what that is. And sometimes a test doesn't show us these things. So we love to go, I'm just going to go and get a blood test and that will solve all my issues.
Yeah.
Not necessarily, because it may not be something we can test for. And it's also having the right person reading the test. So again, maybe we can test for it. Maybe I should reframe that. Maybe we can test for it, but you've got to have the right person reading the test to get the answers that we're looking for.
Gotcha. That's one big thing I noticed, is that different practitioners, compared to, say, a GP, analyse blood results very, very differently.
Yeah, so it's one thing to read a report and it's another to interpret a blood test. They're not the same thing. And then this is a whole discussion. A lot of women will actually ask for a test in something specific and not be provided with it. The pathology lab actually decide whether or not the test goes ahead, not your GP. So if your GP requests, let's say, a thyroid test, and that they put that request through, you go and get the blood test, and the first marker that they test is your TSH, which is thyroid stimulating hormone. If that comes back okay, the pathology lab will say, well, it looks like this is okay, so we won't test any further thyroid hormones. Where in actual fact, it could actually be something down the line that is the problem, not that first point in testing, the thyroid stimulating hormone. So your GP will get that report and say, oh, your thyroid's fine, but we actually haven't tested it properly at this point in time. So this is why women are getting conflicting answers, and it is a bit of a disconnect between all the moving parts when it comes to testing. But then at the same time, if your GP is purely reading a report and the reference ranges, which is what they're taught, this is not any disservice or discredit to them, if they're just reading a report, And so long as you sit within the range, you'll be told that you're normal. Now, you never want to be at the bottom or the top end of a range. You probably want to be in the optimal range. So this is what we want to try and look at is, okay, well, where are you in a range? Is it optimal or is it proportionate to other hormones? And then we can use that to drive what the next best step might be. So there are a lot of moving parts when it comes to testing. It's getting the right pair of eyes on a test. It's great to be told you're fine, but if you don't feel fine, then there's something else going on. Exactly. So it is getting the right tests performed as well, and that can all be a challenge. At the end of the day, the only way to really get the testing that you want done is to pay for it. It's not something that we can bulk bill necessarily.
And you know what? I'm such a big advocate for testing because our bodies are all so different. And as I always like to say, I think gone are the days of just buying supplements over the counter or something like that, because the more that I've tested, the more I've found out so much on a deep level about what my body really, really needs from me on a cellular level, on a DNA level. And it is absolutely fascinating.
Yeah, I think it is very important that we do the right tests at the right time as well. So I should say that, especially when it comes to hormones. A lot of women are also told you can't test hormones because they change all the time, which is absolute rubbish. You can test hormones, you just have to test them at the right time. So that would more than likely be a cycle day 21 test or 7 days after ovulation. Now, if you have a regular cycle that is roughly 28 days, then that is a day 21 test. If you have a longer cycle but you can pinpoint ovulation, you would test around 7 days after ovulation. And if you don't have a cycle, then you just test at any time. They're the general rules around that. But if you are cycling, it is important to test on the right day because, as we've just touched on, your hormones are different every day. But we kind of know where they should be on day 21, and we also know where they should be on day 2, but day 2 doesn't capture everything because you make, like I mentioned before, you only make progesterone in the second phase of the cycle. So to test progesterone, we need to test in that second part of the cycle, which is really important. So capturing that properly is essential. And I see blood test after blood test that is just on any given day. And I'm like, I can't even do anything with this. Because
that's crazy.
Because it doesn't actually tell us much.
Yeah.
And we want accuracy when it comes to this. So it is getting the right test on the right day, read by the right pair of eyes.
So how does that come into play when someone might be on some form of contraception?
Yeah, so you're not going to get necessarily, well, you're going to get an accurate reading of where your body's at on that day, but it's not your true hormones necessarily. Because birth control controls our hormones or flatlines them. So you're getting a dose of a consistent dose of hormones every day, of estrogen, progesterone every day, which means there's no fluctuation that happens. So testing on day 21 is not going to be any different to day 15 or day 12 or day 2. So it is important to know that. It's not that you can't test, it's just there's not really a lot of benefit to testing with women that are on birth control, and if they're on birth control for something outside of contraception. So we should really say there's 2 reasons we take birth control. One is obviously to prevent pregnancy, but we use birth control when women are experiencing horrible symptoms, whether it's endometriosis, adenomyosis, PCOS, you name it. Actually, we use it from everything from PMS to acne to ovulation pain. And mood swings. So if you are using it to treat something, it's important that we actually look at the symptoms that still are there or that are underlying. They haven't gone just because you're taking birth control, because the minute you come off, the symptoms come back. So it's important with my patients, if they do want to be on birth control, that's fine. We speak to the symptoms that they had prior to going on it and treat the underlying problem, so that a lot of women don't want to be on birth control. That's their decision. If they don't want to be on it, then we can help to support them to transition off.
I do really want to delve into that in knowing maybe when is the right time to consider something like birth control if it is being used as a treatment. But I think if we rewind and start back to when we're told to use it as a form of contraception, I'd love to know and get a deeper insight into what your opinion is on, say, taking something like the pill or getting on something like the IUD for preventing pregnancy.
Yeah, so my advice is always, all right, foundationally, as we spoke about, can we learn our cycles first? Before we do anything to suppress any hormones, can we set a young woman up to understand her cycle? The other challenge is that our hormones, our sex hormones, mature at around the age of 21. So if we're
That's crazy.
right, so we're not they haven't fully set themselves up till around the age of 21 and gotten into the rhythm. We definitely know young women go through a phase at around the age of 16 that mimics PCOS, and you might remember going through this stage. I do, where your body shape changes a little bit. You might have a bit more acne. Your periods are a little bit haywire. This is a normal phase, but definitely most teenagers don't realize that. And the person who is generally looking after the teenager is the parent or the carer. We can panic when our cycles aren't regular, but it's important that we know that that's a phase that we go through, and it's a very normal phase. But it's often the phase that we panic and go, there's something wrong. We go to the GP says, all right, well, let's put you on birth control because having irregular periods is stressful, it's unpredictable, but it shouldn't be happening, and utilise that as a treatment. So that's a treatment. We can talk about that in a second because your question was about contraception. But I do really believe that the research shows us that the later a teenager goes on birth control, the less problematic it is to their overall hormone maturation and their long-term hormone health. So what that looks like for everyone's different, and I don't say this to scare people. It's really important that we have the full picture of information. Some women can use birth control and be completely fine, and others they will tell you that they feel like they're going crazy.
Do we know why that is?
We do know why that is, and I can definitely touch on that.
Yeah.
But it is important to understand that if you start birth control, let's say at 16, you are halting that maturation of hormones that, like I said, that happen at around the age of 21. You are stopping that process from happening, and it will pick up once you transition off. So if, let's say, you are using birth control at the age of 16 for contraception, let's say, that's fine. But when you come off, let's say, at the age of 26, your hormones will pick up where they left off. So you actually haven't gone through the process quite yet. So no wonder women come off birth control when they're in their late 20s, early 30s, and they're like, oh my goodness, acne's back, my mood swings are terrible, my periods are awful, because they're actually going through a phase they were supposed to go through when they were younger.
Yeah, that was me.
Right. So it's important, I think, to understand that can have that can for some women be problematic down the track, but research tells us that now. We know that it affects our brain, we know that it affects our hormone maturation, so it is important, I think, for women to understand that. My preference, I have a 16-year-old, I want her to understand her cycle. I want her to understand her fertility. And that doesn't mean fertility is not a baby. Fertility is actually a state that you attain or you have at a certain time. I want her to understand when she's fertile and when she's not, so that we can make good choices. At the end of the day, nothing protects from STDs other than barrier methods. Birth control does not do that. So I think for a teenager, it's really important that we're encouraging barrier methods. And what I would recommend for Olivia, my teenager, is that she understands when she's fertile, when she's not. She uses barrier methods all the time. And if she was to have an accident in her fertile window, then we would go to plan B, which would be the morning after pill.
Yes.
Now, that is, I think, much more responsible, teaching a woman about her body. I don't love the idea of the morning after pill, but it means that she's not flatlining her hormones all year round.
Yes.
She's still going through the ebbs and flows of that, and her hormones are able to mature in a way that they're supposed to.
So if you had to weigh up the cost benefit, maybe once or twice having to take the morning after pill is a little more beneficial.
I think long term, yes.
Yeah.
I wouldn't use it as a strategy every month.
Yeah.
I think that's terrible.
No.
But again, everyone's different, and we just need to assess our own situation. But I think we need to have the information to be able to do that.
100%. I was on the pill from the age, I think, of around 17 to about 22. And I had never had any issues with skin or any other reasons that I went on it other than for contraceptive reasons. And when I came off it, I broke out in really severe acne, and I have spent my entire 20s trying to rebalance my hormones, improve my gut health. But I also feel like at that time, and I'd love to get your perspective on this, I feel like my body had been trying to give me signs that things were imbalanced, but because I was on the pill, I was unable to see these signs. And as soon as I came off it, all these issues flooded to the surface. And it was the first time that I'd really acknowledged any of it.
I think your story is really common, and I think it's appealing to be on birth control also as a young woman. It gives you freedom. A lot of girls are recommended it for the first time when they're going on school camp. I think it's a slippery slope, to be honest, because, I mean, it's convenient and you can skip your period as well. So what I tend to see with women is that if there is an imbalance that already exists and you use birth control to suppress it, if it's left unattended over a period of years, when you transition off, not only do the symptoms come back, but they often come back worse than what they were before because the imbalance has continued. So again, I'm not saying you shouldn't use it. In fact, sometimes for some patients, it is their decision, but it's probably the best decision to utilize it, and then let's treat the underlying problem with the idea of transitioning off so that they don't have to suffer. At the end of the day, we have many options at our fingertips, and it's what's, again, best for you. But a lot of women will report symptoms slowly creeping in whilst they're on birth control. And then one day they'll be like, oh my goodness, I'm breakthrough bleeding, I'm breaking out, I'm hormonal. And it doesn't seem to perform the way that it used to because I think your hormones actually become loud enough to control. The pill is effective, but it's pregnancies happen on the pill all the time as well. So and for various reasons, where it again is it one dose. So one size fits all as a dose, and sometimes that cannot work for various reasons as well. So there's so many. It's such a big topic, and I don't want women to be afraid. I've seen that we've spoken about this in other podcasts, and the feedback has been, "Oh, this is fear mongering," and it's not. It's just information for you to make the best decision. Also, I live for the day where a woman is prescribed birth control, but she's also prescribed a probiotic and a multivitamin, multimineral, and some fish oil and things that are going to help to support her body because medications all have side effects. And we know the pill robs our body of essential vitamins and minerals, except for iron. It's the only thing. It's the only positive. It disrupts our gut health and our gut integrity. So, I mean, that's foundational in itself.
I think that's one thing that people don't realise, what I certainly didn't realise, is that our hormones are so interlinked with our gut, and so it does directly correlate, and then obviously our gut is directly correlated to our brain. So it really becomes this full 360 picture once we start dabbling and changing our hormones.
Yeah, exactly. So knowing all of this, and to your point before, there are women that can't take birth control, and it's usually because of the hormone imbalance that already exists, and it's usually because they've already got too much estrogen in their body and they're adding more estrogen. But these are the women that will say, I am crazy when I take birth control. I fully am not me. The other thing that I find, because it does alter our brain, and there's a fantastic book by Dr. Sarah Hill, it's called Your Brain on Birth Control, and I highly recommend that every woman reads it because it's fascinating more than anything. But it does alter the way that we make choices and decisions. And so a lot of women will come off the pill and they'll say to me, I didn't know what it was to feel like me. I've been on, and also I want you to think about this. At 16 or 17, we don't know ourselves at all.
No.
Right?
No.
So even that in itself, not really knowing yourself, not really knowing how you feel about things, or just having first-time experiences of feelings, that gets flatlined too.
Yeah.
So being 27 and coming off birth control and then all of a sudden going, oh my gosh, is this me? I kind of love me, or I kind of don't love me, or whatever that is.
It's so true. When I came off it, actually, my boyfriend at the time, a week after I'd come off it, I don't even know that he'd really taken note that I had come off it. And he turned to me and he goes, you've just been so calm the last week. What's gotten into you? And I was like, oh my God. And I really noticed that the way I was thinking and reacting to things, it was so different. And I don't think I would have noticed if he hadn't have brought it up. It was almost so subtle but prevalent.
Right.
Yeah.
So, I mean, we have research around this now. There is so much information out there around this, which is so great, because for years, women were saying they either felt one way or another with no validation. Now we actually can validate this. This has been researched. So I think it's wildly fascinating. Not everyone feels good when they come off either. That's something that I have to say. Not everyone feels amazing. Some women love being on birth control because their hormones aren't dancing and they're not experiencing the ups and downs. But that's also, again, feedback your body's giving you that something's not quite right. So always looking at the why, why is my body doing this? Why do I have these symptoms? Why do I feel this way? That's also very important in the big scheme of things. I just really want to reiterate that there's no right or wrong. It's just information, and we can't know how you'll respond to anything until you actually take it.
Yeah.
And you can't know as a 17-year-old if you actually, I don't think you really know how you really feel. Sure, you can go, I feel nauseous or I have a headache, but emotionally, I don't know about you, but at 16, 17, I was just emotional. That's what you are. So
totally.
So I think these conversations are really important. I think we are living at a time where we get to make informed decisions based on a lot of information as to what's right for us.
Do you have a preference between the pill and, say, the IUD? I know you love the natural fertility awareness method, which is what I've been using for many years, and I rave about it too. But between those two options, do you see a benefit in one?
There is a big push for the Mirena these days. I personally, if I had to choose, I think oral birth control, you can transition off that at any time, whereas a Mirena, you have to have that removed from a health professional, by a health professional. And so I guess the preference, everyone has different preferences, especially as natural health practitioners. Some will say the Mirena, others will say the birth control. I think that's probably why it's a preference for me, is it's easier for someone to transition off. What I don't love about an IUD, or specifically, an IUD, is that they can migrate, they can move. There's no exit strategy. We don't talk about any implant and the exit strategy, whether it's breast implants or an IUD. What's the long-term plan? So I think they need to be monitored, and I don't think that they're monitored well enough. And a lot of women will describe a lot of discomfort when they first have them fitted. So they're not appropriate for young women anyway, and IUD is not appropriate. So you're looking at anyone, in their 20s and beyond, once the uterus and everything is matured. The copper IUD is the non-hormonal IUD, and I guess that's probably a preference if you had to say between a Mirena and a copper IUD. You just, again, need to monitor your hormones, you need to monitor your vitamin and mineral stores when you've got any implant, but especially the copper IUD. It can really play havoc with your zinc, which can have a flow-on effect to other nutrients in your body. So I think we just need to monitor them. I don't think there's one that's better than the other. They all come with challenges, and we just got to learn how to best navigate them. The Mirena, for a lot of women, they eventually will stop having a period, and so that can be a preference if you have terrible periods or heavy bleeding. But again, I'm here going, can we just fix the heavy bleeding, please? Rather than trying to mask it, because not only will you be bleeding heavily, you'll have a host of other symptoms that you probably don't associate with a hormone imbalance, but that's the reason that you're bleeding heavily. So even though you're not bleeding anymore, you still have mood swings, you're still gaining weight, you still feel anxious, you're still not sleeping, and that doesn't fix those things.
Yeah, it's so interesting. I love how you keep coming back to the root cause, and I really want to delve a little bit into some really common things that we're seeing at the moment. So PCOS and endometriosis, as well as the other one, which I always pronounce wrong, adenomyosis.
Adenomyosis. It is a tricky one, but if you don't need to say it, then why would you really,
Leave the expert to say it. So I do really want to delve into those. Firstly, do you reckon you can explain what's the difference between them?
They are very different, and I think women get very confused.
Yeah.
PCOS, or polycystic ovarian syndrome, is a syndrome, so it's very different from a diagnosis of endometriosis or adenomyosis, in the sense that it's a group of symptoms and you only need to have several to fall in a category of further diagnosis to say, yes, it is PCOS. PCOS is typically when a woman produces high levels of androgens, which typically, again, and not everyone's typical, that's why I keep saying that, we see either missing periods or irregular cycles, weight gain, hair loss, facial hair, acne are the most common symptoms that we see. And that's due to the body, again, typically having too much testosterone, and that's the on-flow effect of that. So women are supposed to have testosterone. They're just not supposed to have higher amounts of it. And that's why you see these symptoms, because they can mimic a male pattern: facial hair loss on the top of the head, and also acne. So that's very different. Now, the reason I say typical is we now actually have shifted the way that we diagnose and look at PCOS, and we categorise it based on symptoms. Not all women gain weight, lose periods, and have facial hair. We can see post-pill PCOS. We can see post-trauma PCOS. We can see lean PCOS, often with athletes. There's usually some type of trigger or stressor that triggers that, but you might not have those common symptoms. So it can be a bit confusing because you might think, well, hang on a minute, my blood test is telling me that I have higher levels of androgens, but I don't have a lot of those other symptoms. And so now what we do with PCOS is we actually categorize people based on their symptoms, and then based on that category, we can treat them accordingly. It's no point treating someone for true PCOS with elevated androgens when they've actually got insulin resistance and high cortisol levels. So it's really, again, this is where testing becomes very important to see what else is at play. I would say, though, pretty much in all cases of PCOS, there's some level of insulin resistance, and that's due to the high levels of testosterone in the body. So it becomes not just treating the hormones, it becomes back to a gut issue as well, and blood sugar regulation, bowels. Like, there's so many pieces of the puzzle that need to fit together in treating PCOS. But the main thing is getting the right category of diagnosis to then treat it accordingly. And this is why I think so many women have been, they feel like they've failed with their treatment of PCOS because they've been treating the wrong type of PCOS. So to diagnose PCOS, it must be diagnosed with a blood test, an ultrasound, and looking at the symptoms. And it must be those three things. A lot of women will be diagnosed based on one of those things alone, and it's not enough to confirm PCOS. But the real reason women are investigating usually is because their cycles are missing, or they've got irregular periods. Now, endometriosis and adenomyosis typically won't alter your cycle. You'll still have a regular cycle. It's just that you have extreme pain and you have either tissue growing where it's not supposed to be going, that mimics or is like the tissue of the endometrium. So this is also why there's so much pain, is because that tissue responds to the hormones that change each month. You can have endometriosis up as high as the nose and experience nosebleeds at the time of the period because it's bleeding in response to the hormones. So they are very different, and typically the difference being is that, you can still have period pain with PCOS, but you might not have endometriosis. But the difference being is looking at the cycle, and is the cycle longer or missing? Is it regular but painful? They're the differences essentially. Endometriosis and adenomyosis isn't caused by a hormone imbalance, but it's fed by a hormone imbalance. Typically women have too much estrogen in their body, and estrogen we know feeds the endometriosis or the adenomyosis. So it's important to, from my perspective, to go, okay, well, we need to treat estrogen then. If we've got too much estrogen and it's feeding the problem, we can treat that. That's treatable. And the other thing that we see in actually all PCOS, endometriosis and adenomyosis is usually increased inflammation in the body, something, again, that we can treat. So if we can reduce inflammation and then talk to whichever one of these illnesses that we're actually treating, we can do some pretty major things to move the needle in women's health. Even if we were to regulate the hormones properly and treat the inflammation, there's two big things that we can do to help them manage their condition.
So would you say that they're really the root causes of why this is happening, or are there still multiple theories as to what is causing PCOS or endometriosis?
So it's genetic. We can't change our genes.
Both of them?
Both, Okay. I mean, pretty much anything that you present with is genetic, whether it's eczema, asthma, psoriasis, acne, endometriosis. So that's fundamentally it's genetic. But as you know, we can influence how our genes behave.
Yes.
And so that's what we have to do. We have to look at, all right, well, what environment are we in? What does our nutrition look like? The actual biggest thing that I find is stress. And stress isn't just being busy or overwhelmed. Stress is many things. Stress is what your environment looks like. Stress is any trauma that you might have had. Stress is old thoughts and patterns and feelings. Stress can be a relationship you're in. It can be your sleep patterns. Like, it's so many different pieces of the puzzle, but we bundle stress as one big thing, and we think it's just about running late to things and not meeting deadlines, and it's so much more than that. So what I say to patients is, you've basically, when you're presenting, let's say endometriosis, when you're presenting with endometriosis, it's like you've got so many switches flicked on that are triggering your genes to behave this way. We need to flick some of those switches off So your body starts to behave in a different way. And that's how we start to manage endometriosis or adenomyosis or PCOS. And then the next phase of that, once you can stop someone from actually presenting with symptoms or flaring, as we call it, once the flaring is stopped, then we can actually start to put the body into a state of recovery. So there's a couple of phases when it comes to treatments. It's like, okay, I've got to get the symptoms managed and stop you from flaring. And once we do that, then we can start to repair the body. You can't flare and repair at the same time. So the repair would look like recovery. And women say, well, hang on, and then am I cured? It's like, well, if you flipped all the switches back on again, it would come back. So we have to look at what's cured. We love the idea of cured. I want to be cured. It's like, well, no, you can't change your genes, but we can change the way that your body responds to that via your environment. And that's what we must focus on, which is a work in progress. And you're not going to do all of that at once, but it's small steps to start to see improvements. Now, I was never formally diagnosed with endometriosis, but I'm very sure that I used to pass out from the pain that I was in. I would vomit. I would pass out. It would be horrendous. I don't have period pain anymore at all. So, but my life is vastly different to what it was when I was 19. So it is so circumstantial and influenced by your life and your lifestyle and your environment that you can get your body into a state where it's not presenting with symptoms.
So interesting. And I think that's where it comes back to, it's so important to treat the root, because I know some of my friends have been recommended to just get back on the pill to treat something like endometriosis. And then I guess you're just waiting for everything to come back again.
Well, I mean, there's a couple points to that. I will say to patients sometimes, if you are experiencing what I was experiencing every month, where you were passed out in pain, I would literally pass out on the toilet floor, and then I'd wake up and then I'd have a hot sweat, so I'd stick my face on the tiles to cool down, and then I'd vomit again, and then it was horrendous. I can understand why someone would want to suppress that, right? If it's bad enough, I think, well, not even, it's your decision. If you're finding that debilitating, the first step could be birth control. It could be, I don't know. But once you do that, then we've got to look at, all right, what else is underlying here? How can we come in and now start to address everything else without that actually being a stress? Because the stress of getting the period itself for a lot of women is so overwhelming, and it's all about that because that's all they can think about all month round. I go, okay, well, that would make sense. I wouldn't want that either. Then we can come in and actually address these other things that we're talking about. And it doesn't take long to treat these things. If you're on the right track, I would say 9 out of 10 times, each period as you treat it should be 30% better than the last.
When would be the right time to consider surgery for something like endo?
It's a really good question. That's a person by person, I think, scenario. Again, I would say 9 out of 10 patients, we can improve their pain and their symptoms to a point where they wouldn't be considering it anymore. I would say that if after 3 months of actually targeting and doing as much as you can to treat the endo, if you're not getting relief, then you've potentially that's the next conversation. But also there's lots of reasons. There's lots of ways and lots of reasons as to why you might be actually experiencing the symptoms you are. So it's getting the right treatment as well. But with my patients, I tend to say, all right, 3 to 4 cycles, let's reassess. The challenge with surgery is it doesn't treat the hormone imbalances and it doesn't treat the triggers. It just removes evidence of the problem. So for a lot of women, they might have a few months of relief, but then it comes back because they haven't changed anything else. So what I say to women is, all right, let's say that we go ahead with a laparoscopy. No problem. Let's do this work all the while and after so that we can either slow it down or prevent it from coming back. The challenge is also a lot of women will develop scarring, which becomes very painful. I mean, I see women that have had 9 surgeries and they're like literally like, I can't have another one. Wow. And to me that I get frustrated with that because like that's a lot of doing the same thing and expecting a different outcome and getting the same outcome every time. So we have to do things differently even if we choose surgery. And surgery might not be wrong. Again, it's what feels good for you. But let's create some variables so we're not re-emerging into the world in the exact same position that we did before, hoping that the surgery alone, just removing the evidence, is going to fix the problem.
Is there impacts on fertility if you decide to either have the surgery or avoid the surgery?
For some women, there could be. I think that probably in the sense of fertility, it can actually help if for women that are wanting to conceive, if they have a lot of endometriosis and a lot of inflammation and scarring. It just depends on the person. So sometimes it can, no surgery is without complication. I would always try and avoid surgery where you can. But this is where I also think it's really important to support the body all the while having a surgery. And you can't know. You can't know until you've actually had the procedure. It can be amazing, and it can be something that some women will say, I wish I never did. And you can't, there's no way of knowing. There's no, there's no glass silver ball. What do we call it? Magic ball to look at. It would be nice if there was, but there's not. So that's not a really good answer, but there's no way of knowing how someone will respond. And I'm not a surgeon. I'm just there supporting, and I see women coming in. I'm not the one performing that. So again, if you go to a surgeon, they're going to tell you the best way to operate. That's their wheelhouse. But I think there are definitely things you can do to prepare for surgery, and there's definitely things you can do afterwards to help to scaffold your body for recovery, and then hopefully slowing down or preventing the return of the endo or adenomyosis.
The statistics are really fascinating. 20% of women of reproductive age have PCOS, and in your book you also say endo affects 1 in 10 women. Do you think that it's on the rise, or is it just something that we're more aware of?
I don't know how true the statistics are, even though they're printed in my book. I suspect the numbers are higher. I do think that we are seeing more, however, and I think that's a direct result of our modern lifestyle, our foods, our stress levels, plastics, toxins, all these things are big contributing factors, and they present differently for everybody. So, I could have high estrogen, but it presents for me as migraines, not endometriosis. Or it could just present as heavy bleeding. We're all different as to how our body actually is influenced by that. So I do think that our modern lifestyle, however, is a big contributing factor. Girls are going through puberty earlier. We're seeing a lot more challenges. I do also think that there is a big emotional component to endometriosis that gets missed. And I see patients that this is why I focus a lot on, once they start to feel better and see evidence that our treatment is actually helping them, we work a lot on emotional health, because it is often the feeder. And so what I see is women will get better, and then 6 months later they'll be back and they'll say, it's all back to where I feel like I'm back to ground zero again. And I'm like, you're not. But the stressor or the reason, one of the triggers hasn't been addressed. And it often can be a person, it can be an experience. So this is where I often refer patients to see somebody outside of us that works in, I love psychotherapy to help them process and actually rewire the thought process around whatever it is they're experiencing, because I see that to actually be a huge factor with endometriosis and adenomyosis.
Fascinating. It's so interesting how the body holds and reacts to emotion. And that's what I love about the study of Chinese medicine, because that's what they look at, those correlations a lot.
I love that too, because I don't even have to have a conversation with the patient. We can just say, right, okay, what's your dominant emotion? Anger. Okay, I'm going to treat your liver, and then be done with it. I don't need to know why, how, when. But for a lot of women, they don't want to dive back into that. So this is where I think that can also be really important too, is baby steps in recovery. It's like no point going hell into past trauma if it's only going to make it worse. Let's get you physically feeling better, and then you're actually more able to deal with, process, approach, whatever the word is that you need, the trauma or the emotions or whatever it is, to move forward. The other thing is, most of us don't even realise that we've all got some level of some emotional challenge.
Of course.
And maybe you're not even aware of it because you've suppressed it for so long. Maybe you don't even remember it. So this is, again, where I love psychotherapy. I refer patients all the time to psychotherapists. Because they can get in there and really determine, and actually you can recall memories that you have absolutely no idea of.
Deep in the subconscious.
Yes, absolutely, which is fascinating, but it's kind of part of the work.
And I think this is also important as well when we're looking at fertility and also infertility and when treating those kind of things. And I'd really love to touch on that. It's a space that I'm really interested in. But in terms of someone who might be thinking about starting their fertility journey, how long do you think someone needs to prep their body for conceiving?
Yeah, you'll see a lot of campaigns out there, 100 days, sometimes a year. I mean, pregnancies happen in all kinds of scenarios, and if you fell pregnant because you sniffed somebody, then don't stress that you haven't had your 100 days. I think you just reassess and course correct at the time. I would definitely say ideally 6 months off birth control, so 3 months to transition, 3 months to really get the body back to where it optimally can be for conception. But again, it's different for everybody. I try and get patients to lead a healthy life so that if they fell pregnant, we don't need to be like, oh, wow, okay, you're very selenium deficient. We need to sort of, sort that out. We know a lot of challenges that we're seeing are a result of deficiencies from the mother, which is very stressful. So I think it really is important if you do know that you want to conceive, and you, especially if you have health challenges, PCOS, endometriosis, adenomyosis, or just a family history of fertility challenges, I'm like, get prepping, like now. I don't care if it's 2 years away or 5 years away. Like, let's go. Why would you not want to be the best version of yourself? Doesn't mean you're going to fall pregnant tomorrow. And also, to the point of understanding your cycle, a lot of women decide, right, I want to understand my cycle now that I'm ready to have a baby.
Yes.
And the stress of them trying to learn that at the time of wanting to conceive does crazy things to their cycles. So learn it beforehand.
I love that so much. I think because of my whole skin journey, I spent so many years working on my hormone health. And over COVID, I also did a long period of alcohol and was really deep in my health and healing journey. And I just have this gut instinct that a lot of what I did really helped prepare my body for pregnancy and for falling pregnant. And it was exactly that. I feel like I had so much awareness around everything to the time that we did start talking about it. And I was very blessed that it did happen quite quickly for us. But I think that all of that had to have played a part.
100%. Absolutely. I mean, I sit here and I'm in a very similar position to you. Both of my pregnancies were the month that we tried. And I don't say that because I think I'm a hero. I say that because I hope that I practice what I preach.
Yeah.
And then it converts and that can be motivating to other people to want the same. You can't know the pain of infertility until you actually experience infertility. I can't know that pain. I haven't experienced it, but I've watched thousands of women go through that. And the stress and the torture of that, I don't wish that upon anybody.
No.
And I think the challenge is that the longer that goes on, the more stressful and the more dark the situation of something that should be really exciting and very a time of curiosity and excitement. And so how do we bring that back? And I think it just comes back to constantly course correcting for whatever age, phase and stage we're at. How do I live my best life? How do I be my healthiest version of myself? And we should be wanting to do that at all times, not just the motivation of having a baby.
So true.
But I do understand that there is this turning point where you're like, okay, university, tick, career, tick, partner, tick, baby, tick. That's kind of the way that it goes. So I feel like we really do need to change the conversation around this. And there's never a right time to have a baby also, by the way. It's just your time. But we like to think that there's this magical moment where we're like, right, it's going to happen now, I'm ready. And babies are conceived in all kinds of circumstances, but the ones that are conceived without the stress and pressure, I feel like that's a completely different experience. And I want that for everyone.
Is infertility on the rise, or are we just more vocal about it now?
I think it is, again, a direct result of our modern lifestyle.
Yes.
I think women are probably having babies later, and not that there's a cut-off point, because there most certainly is not. And I mean, eventually you're not going to be able to have babies, and I think that's great, because I don't think anyone wants to. I always joke with patients, I'm like, I don't think anyone wants to be changing a tampon at 60. So, there's a cut-off point for a reason, but it doesn't just one day kind of go, it's not a switch. A lot of women go, 35, switch. It's like, no, we're helping women have babies well into their mid-40s and beyond, depending on the circumstance. But I do think that there's definitely, like I said, to endometriosis, PCOS, adenomyosis, we're seeing more and more cases which impact fertility. We're seeing higher and higher stress levels, which directly impacts fertility. There's always a reason that you're not conceiving, even though a lot of patients are told that it's unexplained as to why they're not conceiving. There's always a reason. It's just having someone look hard enough. So I think it's definitely there's more and more incidents of fertility challenges, and I think that's a direct correlation to our lifestyle.
Do you think that being on contraception for a long time or skipping our periods can relate to infertility?
Again, it depends on the individual. So for some women, yes, and for others, no. You'll have someone say, I was on the pill for 15 years, I came off and fell pregnant the next month. It comes down to so many factors, and it also comes down to, your metabolism and how your liver processes things, and obviously your hormones and many, many factors. I do think for some women, yes, it does, but for others, it doesn't seem to. But it could also be that the person that was on it for 15 years didn't actually go on it until they were 22. I don't know. So there's a lot of variables. I think that what we really need to be doing at any given time, like I said, is how do we course correct? How do we constantly look at, even if we're on birth control, how can I still feel my best self? I think they're all things that we need to be considering regularly to be able to transition off when we're ready to have a baby, when we're ready. It should be something that you can decide, I want to do this now and do it. Not something that you have to then go, all right, well, we need to plan for this and I need to get my body ready for the next year. And then, not that there's anything wrong with that, but I just don't feel like that's us living our best version of ourselves.
Agree. So what would be one of your biggest pieces of advice for someone that is going through infertility struggles right now?
Yeah, it's hard. That is a hard road to walk on, and I think the challenge is trying to we kind of start to turn on ourselves. We start to think our body's failing us, and I think it's important to come back to your body's always responding to the environment that we put it in. How do we create variables? What are things that we need to look at? Ultimately, stress is the absolute factor when it comes to taking our hormones offline, our sex hormones offline. Your stress hormones and your sex hormones are so proportionate to each other. So really getting a handle on our stress levels, really looking at our lifestyle. I can't tell you the number of women that I see that are having fertility issues that are working a job, studying full-time, like loading their plate up. And you really need to create space to have a baby. I think ultimately, mentally, we need to actually go, okay, I need to create some space here, because your body knows. It's looking at the environment going, this is chaos. We cannot do this right now. Please don't do this to me. So how do we create the space that's required? And that might mean creating space in your diary, creating space in your calendar, creating space in your home, energetically clearing things out and focusing on what you want, not what you don't want.
Yeah, it's so important. And I think they're also really important things to take into consideration when someone's also considering an egg freezing journey. And I wouldn't mind really quickly touching on this because it's obviously something that is so prevalent and common right now. And what I personally feel is that a lot of people seem to be jumping into getting their eggs frozen but without taking into consideration the whole body preparation that we would consider when we're trying to conceive.
Yeah, I think it will be very interesting. We don't have great statistics yet on successful outcomes with frozen eggs. We have better statistics on frozen embryos.
Right.
Not frozen eggs.
Okay.
So they're different. Obviously an embryo is the next step, in the process. That's right. So I think that is going to be interesting to see. I can only comment on my personal experience when it comes to outcomes, and I haven't necessarily seen amazing outcomes. I've seen a lot of patients who have triggered hormone imbalances as a result of freezing their eggs. So PCOS has been triggered for some women. So to your point, I think it is important to prepare your body if you are going to go through an egg freezing process. I think it's important for you to also consider what you want to achieve out of that. I see a lot of women going for their 5th round of egg freezing. I'm like, what are you doing? Why are we doing this? Nothing is going to be better than your your natural own eggs in their natural environment. That's not to say you shouldn't do it, but I think the challenge is a lot of women see it as a set and forget, which can be great because especially for the anxious, stressed out woman who's, I'm in my 30s, I haven't got a partner, time is running out, I know I really want to have children, that might be your next best option. But I would still say that would be just there on the side and you would probably try and conceive on your own anyway. But I do, to your point, I think it's very important to prepare the body for the process and then also support it afterwards. And really keep that health in check ongoing so that when you do find the right person, you are ready to have children. It is an interesting space watching this play out. So I don't have a good answer other than keeping your body healthy throughout the process.
It's interesting because I remember hearing on an older podcast episode you did that the egg freezing and IVF industry is projected to be sitting at around $20 billion within the next 12 years, which seems kind of crazy when it's something we're obviously wanting to improve and fix our fertility levels, that we are projecting it to grow so much. What are your thoughts on that?
I think a lot of people are turning to it maybe because they think it might fast track their fertility journey. Maybe it might. I don't know. I don't have good answers around this. That's a lot of money. I wonder what kind of projection that would look like if we first invested into supporting women's health in general, and getting, looking at if there is imbalances, how do we fix that, really focusing on natural fertility. I don't know. I do know that there was a clinic in New Zealand that had it was an IVF clinic, but it had a pre-IVF clinic, and I don't quote me exactly on this because it was quite a few years ago. But the pre-IVF clinic, which was more focused on natural fertility, ended up being closed down because the rates of the IVF clinic dropped because they weren't needing the IVF.
Wow.
So I don't know. I mean, don't get me wrong. I think that I have many people that are near and dear to me that have had babies through IVF, and I think it's wonderful that we have the technology. I think sometimes we hit the trigger too early. I think we approach fertility with so much fear that it kind of we already believe that we're going to fail before we even start. And I think we need to start to switch things around to looking at all of the things your body can do rather than all the things that your body can't do as a means of motivation to keep that health alive rather than just assume you're not going to be able to have children.
I love that so much. And again, I come back to that's why I love your work so much, because it is about empowering us and using all the modalities that we have around us to support us for what works for us individually.
Yeah, I think at the end of the day, your body actually, contrary to what you might feel right now, if you're listening to this going, you don't know me and I don't, your body is always responding to the environment you put it in, and it literally knows what to do when we get out of the way. So what is in the way right now from you living your best self? What is in the way of your body being able to function optimally? If you can start to answer that question, I think that your body will continue to respond to whatever it is that you find. So let it guide you. It's not a mystery. We think it is, but it's not. It's right there. We've just got to listen a little bit more and trust that it knows what it's doing.
So much wisdom. Thank you so much, Nat.
You're so
Before I wrap
welcome.
up, I really love ending my episodes by asking our guests to leave a little verbal entry in the Tess Talks diaries. So this is just a little piece of advice or a lesson or an insight that you think is really important to leave behind. So what would you like to share?
I think to the point of what we've just spoken about, it's really important that we start to listen to the little signs that our body is serving us every day. And it's not a wrong or a right. It's just being curious about, okay, how am I feeling? What is my body trying to tell me? And leaning into that and being more curious as to what that might be. And then one other thing I would say is, how can you start to look at all of the amazing things that your body is doing every day? What are the parts that are working? Where can you see evidence of health? And if every day you got up and you focused on what was working, where you saw where you saw evidence of health and having gratitude for that, I think we would be in a very different place.
That's amazing. And I love that you brought up being curious, because that's all about the mission and ethos of this podcast.
There you go.
So good. Thanks, Nat. Where can people find you if they want to come and visit you? If they're not in Melbourne, I know they can do one of your online masterclasses.
Yeah, we have so many places to help people. NatKringoudis.com or Nat Kringoudis on Instagram. We have everything from, I feel, amazing free resources right through to holding your hand, and as a one-on-one, but everything you can find at natkringoudis.com.
Amazing. Thank you, Nat.
Thank you so much.
Thanks so much for listening. If you loved the episode, please subscribe, rate and review. It honestly means so much and helps to keep these conversations going. And I'd love to connect with you. You can message me on Instagram or TikTok, and I've left all the details from the episode in the show notes below. I'll see you next week.